Pediatric neurology has a lot of potential applications for interoperability. First of all, when you're a pediatric neurologist, you're dependent entirely on information. You need to have the different notes and clinical information about a patient. Without that information, you really cannot treat the patient effectively. You do not know what medications they're on. You don't know what type of, for example, I'll talk about epilepsy. With epilepsy, there are many different types, and you need to know the assessment, what was the report on the patient's EEG. And when you're dealing with children, there are a lot of different types of epilepsy. Many of them are genetic, and there are many different types of treatments. So you need to have access to all that information, and many times patients will come to a specialist and they've been treated in a community hospital and you do not know what medications have been tried. It's very important to know the history of what the course of treatment has been for a child. So first of all, I would say just having access to what has been done, the historical information, and you can have just text information. And second of all are the images. Imaging of a child's brain is very important because they change so rapidly. You need to have the latest information. The next step of interoperability, I think, beyond kind of like where we are today, is to actually get those EEGs with the electroencephalograms that show you the waves of the brain activity as to what type of epilepsy a patient has. And beyond just the EEG, you have the images, and then you have the genetic profile of a child and the treatment and how they've responded to it. I think a lot of this, you need to see how well the medication has been adhered to, how much of they conform to what has been given to them in terms of treatment. And a lot of times urine exams and other tests allow you to see if they've actually use the medication appropriately. So all this integration of data allows you to actually see if a medication is effective and if they're actually getting the right treatment. And what really motivates me in a job is to tackle a problem that has never been attempted before or others have failed at. And I can see that there is a way that we can actually tackle the problem, and it's something that is part of a group, a consortium perhaps, and there are many different parties involved that are actually well vested. They have a vested interest in this problem we're trying to solve. If it's something that actually has a very important outcome, something that is meaningful, those kind of situations, I think, for me, are very attractive because you're actually doing something worthwhile with your time. The type of project, if there's a data science element involved, I really look forward to that because it's allows you to really get at the root of the problem instead of just anecdotal evidence that exists. So having the right business backing. In my line of work, I work for a corporation, so if you have the right business support and you have the right problem that's been well defined, and then the client or the customer that asked for the job is really vested as well, and they really care about the outcome. And then funding is very important as well, because without that you're not going to go anywhere. Something that really I get discouraged about if any of those aspects are not available. If the business is not heavily vested, you're not going to have enough resources to accomplish what you want. If the client is not involved, they're not going to be on top and respond to your requests. And if it's not an interesting problem and there's not a way to tackle it, and it's already been done before, then it's probably not likely to be done. So if there's not much teamwork, if there's not much support, and I can see those from the outset, those items would discourage me from working on a project or even being interested in thinking about that project. In the next 5 years, that's a very far timeline with technology. That's almost these days, it's almost light years. I could almost tell you in a year or two from now, but 5 years, I hope that we are in a position where we have complete interoperability, where different governmental systems that capture information, obviously hospitals, we're already almost there now with clinical interoperability, and different biological data sets such as, like I mentioned in my talk today, the genomics, transcriptomics, microbiome, all that information, it can be integrated along with the sensors and devices that we will have and will be connected to the overall wireless network. We're capturing all this information and in some ways observing what we can to figure out what is actually causing a patient to have a certain outcome. It's almost like you have an experiment of you're in the number of people in your experiment are one, because it's personalized medicine. That's where I think we would hopefully be at in 5 years from now. And the other was international interoperability. I think that's important as we become more of a global society. We're going to want to have the ability to go from one country to the next and have our medical records follow us. And so that way we're really spending less money. We're focusing on bigger problems instead of things that are more maybe political or administrative. And we're able to focus our energies as a world on bigger problems such as environmental impact. I think right now we as people we have so much potential, and I think technology is one thing, but also we need to change our culture and how we view our own health. I'd like to see that a lot more individuals are taking ownership of their own health, and hopefully we'll have intelligent systems that will kind of guide us in one direction, or where in the past we would have the doctors tell us exactly what to do. And we hopefully will be more educated and have kind of like a chatbot where we can talk to and ask, what is my problem? What are the symptoms? And it can be a nice dialogue. Although you still will need the person at some point. There's something special about human touch, human interaction that in some ways cures people just on their own. I think the last thing I'd like to say, I think that robotics is going to play a big role in the next 5 years. That is, you have maybe robotic assistants for elderly individuals in their homes. You may have robots that really guide individuals to do exercise. They lead your exercise group. They focus in on what items that you need, and combine that with artificial intelligence and more data. I think we're going to have a totally different set of circumstances and potentials. There's going to be some hiccups along the way and probably some privacy concerns. But if we have the right intentions in mind and we make sure to focus on the important aspects of what we're doing, and I think that we'll get there.